What up, Z-Pack? It's your boy Z-Dog MD. Check it out. I'm live and direct from Charleston, South Carolina, where I'm doing a gig tomorrow. It's a bit of a surprise, so I can't say who it's for, but I will tell you guys later. In the meantime, what I want to tell you guys about today is an article in the Washington Post as well as in Vox and other news outlets talking about the measles outbreak in Minnesota and how it is disproportionately affecting the Somali community and how they have been disproportionately targeted by anti-vaccine activists such as the Dark Lord of the Sith, Andrew Wakefield. I want to go through this article a little bit and kind of talk about it because I think it's very important that we as healthcare providers understand the true face of evil. It is former doctors like Andrew Wakefield, who had his medical license revoked in Great Britain after it turned out his seminal study in the late 90s linking autism to the MMR vaccination was not only erroneous and incorrect, but also fraudulent, as he was being paid by lawyers who were suing MMR vaccinating companies. So, that all being said, let's tie it all back to evil, the targeting of a vulnerable minority immigrant population in the heartland of America, and the resurgence of a infectious disease, measles, which had been almost entirely eradicated in the United States by 2000 and is now coming back with a vengeance because of dangerous morons like said Wakefield. All right, guys, let's do this. And then I'm going to take you on a tour of this hotel at the end, so stick with me to the end. Also, there's a button at the bottom that says donate to Doctors Without Borders. If we're going to talk about public health and we're going to talk about saving lives and we're talking about vulnerable immigrant communities, we are also talking about Doctors Without Borders that helps all of those things, and they are amazing. So please donate if you can, and that will be our good deed for the night, as well as talking about vaccines, which is another good deed. All right, I'm going to go through this article, and then I'll take you on the tour of the hotel, because you know I'm in Charleston. I got to show you this hotel room. It is pimped out, people. All right, here we go. By the way, happy Nurses Week. I hope you guys like the videos. We're going to keep them coming. Anti-vaccine activists spark a state's worst measles outbreak in decades. All right, and it starts about talking about this young Somali mother who's an immigrant. They're a very tight-knit community. The largest Somali population in the U.S. is in Minnesota, according to this article. And apparently, this community in around 2008, it was noticed, it was theorized that they had a higher rate of autism than local folks. And so this was actually studied later and was found to be untrue. But at the time, they thought, wow, everybody in this preschool who's Somali seems to be autistic. Maybe there's something going on. Well, guess what? When the words autism came up, the vultures of the anti-vaccine movement, the now discredited, the long discredited anti-vaccine movement, because there's been plenty of data now that shows no correlation between MMR vaccinations and autism, period. It is settled. It's done, period. It's not even a question. This isn't a debate. That's false equivalency to even call it a debate. The vultures of the purported anti-vaccine movement descended on this community, including none other than the Dark Lord of the Sith, Andrew Wakefield, the founding father of stupidity and evil and greed and everything that is wrong with doctors that can possibly be wrong with doctors. And what I love about Andrew Wakefield is he accuses other doctors of being shills and being evil and being misguided, when in fact, if he held up a mirror to himself, it would melt from just the pure evil of it. So he swooped down on this community along with other anti-vaccine activists, such brilliant scientists as a businessman whose child had autism, who would have town hall meetings here. Let me see what the name was, because I want to publicly shame this guy, although I'm very sad that he has a child with autism. I'm not going to show him any mercy for harming other people. I guess we'll get to it when I get to that part of the article. So these guys were having town hall meetings, meeting with Somali immigrants and telling them, do not get vaccinated. MMR is associated with autism. And guess what? These are vulnerable immigrants in a new community. They trust in Western medicine. They had higher rates of vaccination of their children than the local population did, the US-born population, prior to this intervention from the anti-vaxxers. Now, they've dropped from a 92% vaccination rate after being brainwashed by the anti-vaxxers who specifically targeted them because they were vulnerable, they were in a new community, there may have been language barriers, and they were concerned about autism because of the false assumption that they had higher rates than locals. Well, than local-borns. So 42% Somali American vaccination rate in 2014 relative to 2004 when it was 92%. By contrast, the non-Somali vaccination rate was 88% in 2004 and has risen to 89%. This is close to national rates. Around 90% of children get their vaccinations, and 10% are the children of people who have either been brainwashed or are actively stupid. So that being said, what ended up happening was a great tragedy. This population now does not have enough vaccination rate to sustain a herd or community immunity. And now we have 44 cases since April of measles. Now, you guys have to understand, measles is one of the most infectious diseases known to humankind, all right? So we're only seeing the beginning of this. There were recent outbreaks, Disneyland, all of that, that showed how quickly this stuff can spread. In that instance, somebody was on a ventilator, an adult was on a ventilator for 3 weeks, okay? This is a serious disease that I forget what the hospitalization rate is. It's in the article, and I will link to the article. And I'm sorry, I just got off like 8 hours of travel, so I'm a little bit behind in my research of this particular article. But the vaccine being around 95% effective, the hospitalization rate is something like 1 in 10 kids with measles get hospitalized. I forget what it was. But it's significant enough that pneumonia is one of the big problems. You can get encephalitis, and you can die, period. This is not a trivial disease that you just get and you get better and it's one of the rites of passage and it makes your immune system stronger. Wrong, 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 wrong. People die. And in fact, Somalia itself is plagued with measles because they don't have access to vaccines. And people like Doctors Without Borders would gladly go in there and vaccinate. When I met with them in London, when I did a talk for their science division, their vaccination campaigns are legendary and heroic. So click the button beneath this. We've already raised $275 since I started this broadcast. Keep it coming for Doctors Without Borders, because we can complain about anti-vaxxers, but unless we put our money where our mouth is, we're not going to change anything. All right. That being said, Wakefield and his goons brainwashed this population. Now they are suffering from measles to the extent of at least 44 cases. And it is now going to bleed into people. And of those cases, only 2 were vaccinated. And remember, vaccines, they're 97% effective. So people who don't have the vaccine take effectively can still get measles even though they've been vaccinated. And this is one of the clownish arguments of the anti-vaccine movement is, well, you see, they weren't vaccinated. I mean, they were vaccinated and they still got sick. Yeah, you're an idiot, okay? Do you science? I wish Logan were here so I could hit the science button, because it's time, okay? So that all being said, let's go dig into this, okay? At one 2011 gathering, okay, featuring Wakefield, an armed guard barred her and other public health officials from attending this meeting, okay? As parents sought to learn more about the disorder, they came across websites of anti-vaccine groups. Activists from those groups started showing up at community health meetings and distributing pamphlets were called Linbada, a longtime state health department nurses, especially the ones that represent public health. Longtime public health department nurse who has worked with Somali nurses to counter MMR vaccine resistance within the community. So she was barred physically by guards from entering this building. Fear of autism runs so deep in the Somali community that parents whose children have recently come down with measles insist that measles is preferable to risking autism. Okay, now this is a cultural thing. We have to forgive this population. But you know what? American anti-vaxxers say this. Oh, autism is a fate worse than death because I would rather risk a childhood illness that might kill my child or another child or a vulnerable elder or a young person than let them become autistic. And I know mothers with autism who are right here, ZPAC, who are ZPAC members, would take umbrage at that, to say the least. And I'm looking at several of you right now, right? I've heard from Cynthia. I've heard from many others who are like, this is a disgusting precept of the anti-vaccine movement, and it's almost animal in its stupidity. So, and its immorality and its lack of compassion. Okay, that being said, really quickly, there was a 23-month-old who was on IV fluids, repeatedly pulled out oxygen. Her brother endured a milder bout of measles. Neither had received the MMR vaccine. So these are children who are suffering in the hospital after getting infected with measles. And the father, who's 33, was studying mechanical engineering while working as a mechanic, wants to wait still to vaccinate because his worry is autism. All right, guys, this is an education issue, right? You can imagine the fear in a community that's instilled with fear by these horrible, horrible, horrible human beings who go around telling people discredited theories about autism instead of actually studying what could actually cause autism. Like, what is the cause? They're wasting our resources. They're destroying lives. They're killing young people and killing old people. And worse than that, they're spreading a distrust of the scientific community and an anti-scientific mindset that's now permeated every level of American society. It's dumb on every level. It's dangerous on every level. All right. Now, here's a quote from another Somali. "For God's sake, I want to know if vaccines are safe," Sarah Osman shouted. She has a nearly adult son who received an autism diagnosis when he was 3. "My people are suffering. We are not ignorant. I read a lot. I know a lot. I educate myself. You don't know what you are talking about." And that's what she was yelling when doctors, pediatricians came to address the group and said, "Look, guys, you got to vaccinate." The doctors got booed down. This doesn't happen de novo. This happens with prompting from really, really bad people. People who should know and do know better, like Wakefield, who is a criminal who lives in like a $3 million house, who basically has profited from this whole scam that he's run since 1999. He is a criminal, you guys. He's a criminal. This isn't a doctor, okay? This is a criminal. All right, that being said, what I want to tell you guys, I'm going to link to the article. I want you guys, as a call to action, to teach anyone who's listening with compassion, listen to their fears and say, yes, I know it is scary. And yes, we don't know what causes autism, but we do know that vaccines are safe. The side effect rate is incredibly low. In fact, it's so low for measles, MMR, that it's hard to even know if the vaccines cause the actual side effect because the rate of occurrence is so incredibly low. I'm not talking about fever, which can happen very frequently, all right, or rash at the site or generalized rash. I'm talking about serious complications, encephalitis, etc. All right? So that being said, spread the word. Donate to Doctors Without Borders. We've already raised $560, and it keeps coming up. Thank you, Mary Lou Wentz, for donating. And this is a wonderful way to put our money where our mouth is, Z-Pack, because we together can promote science and understanding and compassion and save children and save adults. And my room service is here. Let's say hi, shall we? Here we go. Hi, how are you doing? Yeah, nice to meet you. You know, I'm Facebook live casting. Do you want to be on it?
I'm shy.
Are you shy? Okay, come on in and I won't show you. I won't show you. I'll just show the food. Look at that. There it is.
I'm shy for a Scotsman.
You're a Scotsman?
Aye.
Are you sure you don't want to say hi to these guys? Just tell them you won't. They won't see you. Just your accent's amazing. You got to say something.
Hello, world.
Hey, there it is. Thank you. So perfect. So while the food is coming in, Z-Pack, I just want to tell you guys, there's only 1,300 of them watching right now. This hotel is amazing. It's in Charleston, South Carolina. It's called, what's it called?
Charleston Place.
Charleston Place. Says the least southern gentleman that I've met yet, a Scotsman. Who's
Southern Scottish.
Southern Scottish, exactly. And here's my my one meal of the day, which is...
Would you like me to open up the full table?
No, this is fine. This is
Just
perfect.
one side?
All right, here we go. You ready, Z-Pack? Here it comes. And please donate to Doctors Without Borders. We got $745, so don't mind the rich meal I'm having right now. All right, here we go. Bam. Oh, shrimp cocktail. Nice. Nice.
And also, I got your hot items down below here.
There's more, guys. Let's go over here.
I have a selection of bread.
Woo!
And I'll put that next to your crackers with butter.
Thank you, sir.
You're very welcome. And I brought a share plate also, if need be.
Thank you for my imaginary friend.
You're very
Wonderful.
welcome. However, I was told there was 2.
Yeah, well, I always say there's 2 because I'm embarrassed that there's only 1. So I always, what's the service for? I'm like 2, but really it's just me eating a pizza and shrimp because...
Well, that way you got extra silverware and you got extra water for yourself.
Oh,
okay?
fantastic. Thank you, sir.
And please be careful, Mr. Dummy. This plate is very hot. That's your
Oh, so yeah, I don't mind if that... Ow!
Exactly.
Yeah, he's not kidding. Oh, look at that.
Also got some dried chili peppers for your pizza, if needed.
Look at that.
All right.
That is amazing. What can I sign?
Oh, it's right here in this wee black book.
Perfect, perfect, perfect. Thank you, sir.
Yes, sir.
Great, great, great.
So how long have you been in Charleston for? Just got here?
Like literally 30 minutes.
30 minutes, so you're just fresh off the plane?
It's fresh off the plane, exactly right.
Alright.
Thanks for being a good sport.
Absolutely no problem, sir. Anytime. And congratulations on arriving.
Yeah, well, I survived the trip. That's 70% of the battle.
There we go.
Thank you so
Keep
much.
us keeping you. All the best now. Take care.
You
Bye,
too.
Ronald.
Thanks. Hey, do you want to say bye?
See you later.
Bye.
Cheers. All the best.
All right. Take care.
Take care. Bye-bye.
All right. I'll let you out. Sweet. Thanks, man.
No problem.
Take care.
Good night.
Oh my gosh, how awesome was that? That was amazing. The dude was so cool. His accent was so legit. It was like he was fresh off the boat from Scotland and immediately got attacked by Andrew Wakefield and told not to vaccinate his child because he would become autistic. Immediately. By the way, Wakefield is an Englishman. Okay, we won't hold that against him. We love it. We love the Brits. That was awesome. So guys, should we do a little tour? For people who are listening on the podcast now, I'm really sorry. I'm going to try to edit that part out for you because it'll make no sense on a podcast. But for people who are watching live, enjoy that. Click. Oh, we've raised $805 for Doctors Without Borders. How awesome is that? All right, let's take a little quick tour of the facility because you guys have to see this hotel. And for podcast people, I'm going to edit right here. I'm going to say, go do your thing, change the world. Okay, for everybody else, here we go. Check out this incredible balcony. Charleston, South Carolina. Just beautiful. Southern charm. Cool old school buildings. A moon and some stars. Ah, isn't that nice? Listen to it's hard to hear, but there's a fountain down there. Thank you for donating, Melissa Turk. Let's take a walk. So we've got the bed where no magic happens because I'm all alone on these trips. I just got in and I'm leaving tomorrow. There's my little computer space. Look at these beautiful, look how nice this is. It's so southern. You got your magazines. Then we come over here with the room service that I'm going to eat shortly. The bed. Nice TV. Now look at this dresser, you guys. I've taken you on a lot of hotel tours. Look how nice that is. That's a real piece of furniture. That's not hotel crap. And they got two things, which is really nice for the bags. And then you come over here, just gorgeous. And look at this bathroom, all right? Really nice, like nice fixtures. And then over here, like a cool toilet area and I don't know what this is. He's a recruiting officer for the Brits. And then come around here and you've got the dope shower. Look at the shower and all kinds of cool stuff I'm going to steal for my kids. Come out this way. And there's the room again. So guys, on that note, I want you guys to share this live cast, so I'm going to keep it short. It has been legit. I'll try to broadcast again tomorrow. Thanks for joining me. Guys, fight the good fight when it comes to vaccinating our children. These are dangerous, deadly diseases that we have the power to stop, and we should do everything we can. Thank you to everybody who's raised $980. 35 people donated to Doctors Without Borders during this broadcast. We've done good in the world today, Z-Pack, and we out. Peace.